When we've looked a little bit further, trying to sort of investigate a little bit more some of the comorbidities that have been found to be important, one of them being hypertension. And hypertension is one of the risk factors for cardiovascular disease. And we know that cardiovascular disease in general is quite a concern in rheumatoid arthritis. There's an increased incidence of cardiovascular disease, of heart attacks and strokes, and it actually causes increasing death rates in people with rheumatoid arthritis. So it's something that we have to be very concerned about when we're following people with arthritis over time. And when we're seeing higher rates of hypertension and cholesterol, which are the risk factors for cardiovascular disease, these are things that we really need to address. So there have been some studies in the CATCH cohort that have looked at factors that are associated with high blood pressure in patients with early arthritis, and they found a number of factors that are not unexpected are associated with having high blood pressure. Subtle differences between men and women, how significant those are and how clinically relevant those are I think need to be further studied, but certainly we are finding higher incidence. Another thing that we've looked at is a condition called metabolic syndrome, which is basically a combination of risk factors that are associated with heart disease. And we've looked at this in the CATCH cohort, and we found that the risk of metabolic syndrome is also high in the CATCH cohort. And again, this suggests that this is something that we need to think about when we're managing arthritis and not forget that, because we know that there may be shared pathways of inflammation that lead to cardiovascular disease or heart disease and arthritis. Another comorbidity that's very important that we really must not forget is mental health, because mental health has a huge impact on how people manage with their arthritis and also how they do with their arthritis over time. It affects how people respond to treatments, it affects the medication they're using, it affects how people just manage with their arthritis. Definitely affects health-related quality of life as well. And we know that there's probably some shared pathways of inflammation that leads to depression and inflammation that leads to arthritis. And so we need to understand those connections a little bit more so we can properly address both the rheumatoid arthritis and the depression, because it may be different ways that we need to treat these conditions.